Alberta will return to mostly normal life once again, just ahead of spring. The Premier announced Saturday that hospitalizations and case numbers are at a point where we can move into phase 2 of the reopening plan on Tuesday. And once again, there are mixed emotions. Fear, anxiety, and excitement are common when it comes to changes related to the pandemic response. For the hospitality industry, who will now be able to work at full capacity, there's optimism.
Staff are excited to be able to, get their full-time hours back. And for a lot of those neighborhood pubs, live music venues, lounges that stay open till 2 a.m., now they're complete. They'll have full hours accessible for their staff.
Capacity limits for venues and social gatherings will be dropped. The work from home order will also no longer be in effect. There are still quarantine requirements depending on vaccination status, and acute care settings will still have certain restrictions in place due to the vulnerable populations inside them.
For the average Albertan who's been immunized, this is not going to have any effect on their long-term outcomes, but a small proportion will end up having to be admitted to hospital, and we currently have quite a large number of people in hospital.
Dr. Dan Gregson is an infectious disease specialist with the University of Calgary. He says Alberta is moving fast, and there's some concern that hospitals are still dealing with a lot of COVID-19 patients.
At some point in time, we have to remove these restrictions. I think my concern is more about, we have a workforce in the healthcare sector that has been working very hard over particularly the last year, at taking care of patients with COVID. And it would be nice if we didn't stress them more than we need to.
When it comes to schools, the Alberta Teachers Association also feels the move is too soon. In a statement, they said they're concerned this plan privileges short-term partisan political priorities over longer-term education or public health considerations. In Calgary, the public mask mandate only remains for hospitals, acute care settings, and transit. But Edmontonians will need to continue wearing them in public a little bit longer until certain benchmarks that city has made are achieved. In Calgary, Taylor Braat, City News.